Welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Herodopoulos, and today we're talking about varicose veins and what you can do to help them. It is estimated that 25 million Americans suffer from varicose veins, and it's not always just a cosmetic problem. Joining me to discuss what you can do if you suffer from varicose veins is Dr. Irfan Imami, board-certified vascular surgeon at Cosmetic Laser Solutions with TPAS Healthcare. Thank you for being on the show.
Well, thank you. I appreciate it.
Well, okay, let's talk about what is varicose veins?
Well, unfortunately, varicose veins trouble a lot of people, and they're just large, unsightly veins on the legs which cause people discomfort, pain, and there's easy solutions for them.
So there's 25 million Americans, like I said, and there's many risk factors. What are they?
Right. The number one risk factor is typically a family history. So if mother, brother, father, sister has it, there's a good 60–70% chance you'll have it. Others, jobs you've been on your feet a lot, multiple pregnancies, blood clots, and broken legs from car accidents typically lead to varicose veins.
So now we know what the risk factors are. Let's say you have it. What are some easy things that you can do when maybe they're not so bad to help prevent the progression?
Well, I definitely try to be in an exercise program. Try to walk as best as you can, then leg elevation at night, maybe a pillow underneath your legs when you go to sleep. And then lastly, compression stockings. Start out with something over the counter and then go to prescription grade.
So we were talking earlier, and you mentioned that crossing your legs and maybe wearing high heels doesn't really cause.
Right. Those are old wives' tales, you might say. Crossing legs, wearing high heels.
All right.
No.
Now I could tell all my friends who say,
right, high heels.
It's only a matter of time, Stephanie, before you're going to get those varicose veins because I wear high heels every day.
No, it's all a myth.
All right. So I'm not going to be one of your patients one day. So then there's things that you can do if they're like spider veins or reticular veins. Those are like the small looking ones that aren't the ropey, and those are more cosmetic. But when they become painful and you get swelling and sometimes even they progress to the ulcers and they're bleeding, then that's a medical necessity to have something done. Can you talk about procedures that can help that?
That's right. When we start to have heaviness, tiredness in our legs and swelling by the end of the day, that's when there's a problem. And we as physicians need to figure out how we want to treat those. Those are now considered not cosmetic. It's all medical grade. So there are options to do minimally invasive treatments. Folks have heard about vein strippings. That's 10 years ago and more than when we did that.
Okay, ancient.
So now we have minimally invasive methods, endovenous ablations, which really take about 20 minutes in the office. They're covered by insurance carriers. You walk in and you walk out. So it works really well.
And then, so the recovery time for that is about
Recovery
how long?
time is typically 2 weeks, no weightlifting, bike riding, or aerobics. That's it. I encourage my patients to walk.
And they wear the compression stockings during those 2 weeks?
During the day only.
During the day, okay, so not a bad. So here we are, you have these unsightly, ropey, painful veins in your legs, and there's something that you can do about it, and your insurance might pay for it.
Correct.
So what are you waiting for? So you're doing these screenings at your office. Tell me about that.
Right, we're doing screenings to see patients who have a lot of varicose veins. We don't want patients to progress to ulceration. That's sort of the end result of venous disease. So we're offering free screenings, quick ultrasound if necessary, and figure out really are you a candidate or not to treat
and that's at TPAS Healthcare, and that's up till the end of October that you're offering that service.
Correct.
Well, wonderful. Well, thank you so much for being on the show.
My pleasure.
And I'm sure my viewers have learned so much.
Thank you.
For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health section, or visit floridatoday.com.